We're going to have some fun this morning. How's it going?
Oh, wait, Gardy, it's great to be here. This is Living Well Clinical Nutrition Center. My name is Dr. Aaron Chapa, and I have my good friend and lead clinician, Jennifer Withy, hanging out with me today on the radio. And we always love coming and being a part of the world in the social realm. It's I remember first talking to this microphone and looking into this camera and thinking, man, I'm talking and looking at no one, but yet I'm talking to everyone, and everyone can see me, but I can't really see anybody else. But at Living Well, we always just have a heart to bring a message of wellness, a message of you can overcome and overcome diseases that your body has been dealing with, symptoms that you have been suffering with. And I was sitting back, and Jennifer and I like to read quite a bit. And we read leadership books and goal-setting books and self-reflection books and nutrition books, and we're lead learners, and we want to be an example at our office for what is possible in the speedy aspect of the world. And one of the thoughts that I had this morning is, is sometimes that we are so hyper-focused on goals and production that we lose ourselves in the quest to reach our destiny, our God-given potential, and at the expense we let go of some of the fundamentals of getting back to the basics of health and wellness through nutrition. We've talked many times that health and wellness, like nutrition, is the fundamental backbone that drives health in a positive direction. Or, unfortunately, nutrition can be the demise of a person if they choose. I would like the great Indiana Jones show chose poorly. We don't want to choose the wrong nutrition because we could feed the wrong bugs or bad guys or set our bodies up for ails. And I think that sometimes in our quest to be productive members of society, to find purpose, we find ourselves forgetting that we've got to take care of ourselves. And I think today we want to remind you guys, we want to remind ourselves that you're worth it. You're worth it. I'm worth it, to take care of, because too often do we have moms come in, and Jennifer could speak to this probably, mommy guilt. We have dads that are coming in with anxiety and depression, midlife crises, because they're pushing and striving to keep up with the Joneses and give their families everything they want and need and beyond. And we are forgetting, again, to take care of ourselves, to stop, to breathe, to stop, to make sure that we're getting adequate sleep and doing the necessary lifestyle practice to get our bodies back on the right road towards better health and longevity. Because although we all sometimes sell ourselves short, don't we? We don't reach for our best potential due to a lack of knowledge and or just our own limiting beliefs in our head, right?
Sometimes we just get caught up. We get caught up in all the things that we're thinking about and planning to do, and exploits. You mentioned the books, and I've been reading. There's a story that came up in one of the books I was listening to on my trip last week, and the story was the king was asked, "What are you gonna do, mighty king?" And he said, "Well, I'm going to conquer this land, and then I'm going to conquer this land, and I'm going to conquer this land." And he was then asked, "And what are you going to do when you finish?" And he says,
"Your conquest.
I'm going to rest and relax and enjoy life." Well, he's the king, right? What's stopping you, O king, from enjoying life now? What's stopping you? What are you doing that's allowing you to struggle through life's crazy instead of, going after what you really want? And what is it that you're going to do? So, in our world, we're looking for this quest for optimal wellness. What does optimal wellness look like? In our world, it's three sides to it, right? And so we talk about nutrition because it's one of the entryways into optimal wellness. It's one of the main ones. So when you think optimal wellness, you're talking about the nutrition side, that's the biochemical side. You're talking about the emotional, the spiritual health of a person, and then there's the musculoskeletal. And so if you take all three of those sides and you leave any one of them out, you can be in trouble. But what we've found is that if you interrupt at the nutritional level, you can make progress everywhere. So, Chapa, let's talk a little bit about the new space we're going to have here in League City. We're moving.
We are?
We're moving. Yeah.
We are?
I'll let Matt know up front, and everybody else it'll be okay.
All right, make sure you give me the address.
Okay.
We are moving. We are expanding. We are very excited. This has just been a long road to get here, but we've arrived, and we are planning on being at 322 East Main Street instead of the current location where we have been for the last 8 years. And we're excited because we're going to be able to make just a bigger impact. We're going to be able to serve people at just a different level, and we're really excited about watching this next venture, this next journey unfold for people. And for us, I mean, we're all have grown through this expansion process and getting ready, and I think that that's the faith walk, right? That's the stretch and reaching our capacity, and so coming this Monday, we're going to be at our new location. What is that? The 13th.
The 13th of June.
And so it's just a very big announcement. It's very exciting that we have gotten to a place where we've got all of our ducks in a row, and we can open the doors to living well. This would actually be, I don't know if they go 2.1, but I'm going to call it 3.0 because this is our third location. And man, I am very excited. Our clinical nutrition center is going to be revamped and improved. We're going to be adding some new modalities over the next year toward our detox center, where right now we'll have our foot baths, but instead of them, have you seen the foot bath?
Oh, I've seen them. So if they're looking on Facebook and looking through our
the
photos,
windows,
they're going to see it.
They could come and look through the windows. There's we basically have medi-pedi chairs where people can actually get a massage in while they're having a foot bath, and it's a lymphatic massage, right? It helps to just mobilize tissue, and so people will be able to get the benefit from there. I'm such a big fan of detox. Everybody knows that if you're not detoxing in the 21st century that are my patients, then you're missing a huge healthcare piece, and we always want to be encouraging this detox component. So we're going to have far, mid, near infrared saunas. We were experimenting with these saunas this past weekend. Jennifer, myself, and one of our other clinicians, Greg, were all crammed in this. It really wasn't crammed. I mean, it was quite, surprisingly comfortable for 3 people in there. And we were in there chatting, and the heat was rising, and it wasn't because it was high tension. It was because legitimately mid, near, far infrared thermal therapy started kicking in, and man, so we're excited to see what we can do in the recovery realm for athletes, for the health and wellness of just people that need to relax, and the detox component for all of us that are living in the 21st century. So if you're breathing, you need to consider our Living Well Detox Center and be a part of what it has to offer. And then of course, we haven't done an event in a month or so. And we are in the process of opening the event center as well, and we're going to be, having some new events coming to Living Well, and we're excited about bringing another layer of education, something that is our heartbeat, something that we want people to understand and know that you're in control of your health, and we want to be your health and wellness resource. We want to give you the tools and the practice so that you can integrate this stuff into your family's lives, into your life, so that you can better reach your goals and get to the end goal without losing yourself.
Right. It's not just about education. It's about being in community together, about being together. That emotional that emotional piece of, hey, I don't know how. I remember when I first started working on myself nutritionally, and I was like, I don't even know where this stuff is in the grocery store. I don't know what it looks like. I don't know where to get it. I don't know how to find it. But now we'll have more space where we can come together and help people find a connection so that it's not just me against the world, right? It's not just me against, that great big giant HEB and trying to figure out where all the health food is when it's kind of hidden behind all the processed foods and things like that. So when you think about optimal wellness and you just keep pointing us back to that piece where we'll be able to build community in a space where, we've had some amazing classes at our current location, and we've packed that place out. We've had, 35 people in a room that really seats 8 to 10.
Yeah.
And it's been pretty tight.
Yeah.
And it's been really tight. But on those days where it was really tight, there was connection that was happening. But now we get to do it in a space that's going to be beautiful. That's going to be a place where we can relax. It's going to be a place where we can open the doors and you can come to that event center, and you can actually even at some points have your own events that will allow you to connect with your family, your peers, your church, your whatever group that we need to do. So it allows us a whole new way to look at optimal wellness. And we, sometimes people say, well, I don't want to do a foot bath. I don't want to do a foot bath. Why do I need to do a foot bath? It's an optimal wellness. It's us looking into the body and saying, hey, I know it's hard to eat right 100% of the time.
Right.
I mean, it just...
Gardy, can you do it?
I cannot. No, it's impossible.
Well...
It's impossible, guys.
I think it legitimately...
Living today, it's impossible, right?
I think
there's sugar in everything.
That's right. Sugar is in everything.
Mm-hmm.
And I think that there's truth to that. Like, wow, we have to figure out ways to combat the fact that most of us eat out more than we should. We eat the same 11 foods over and over and over again, and typically those are familiar foods, meaning foods that we grew up with. And a lot of times those are foods that we classify in what we call the sometime food category, and maybe sometimes the never food category, and we still consume them, and they become poisons to us.
Mm-hmm.
And those poisons have to be eliminated.
Right. And the foot baths are just one way to do that. And when you think about it now, and people sometimes have trouble sitting back and relaxing in that foot bath. Well, I don't think you're going to have trouble relaxing anymore.
Mm-mm.
With the massaging going on.
I think we've kind of eliminated some of that.
It's going to give us an opportunity, give you an opportunity to say, hey, no, this is something that I'm choosing. That whole concept of put your oxygen mask on first before the kids in the airplane, that's what you're going to have to do to maintain optimal wellness for yourself.
And so we're just creating an opportunity for you to do that gracefully, peaceably. Mm-hmm. And we built this place, with the idea that people will come just to rest. People will come to chill out a little bit, and they will find another layer of a safe haven that we have been complimented on even through the crazy of COVID. We've had patients would tell us all the time, we're their safe outing. And they would come to our office, and ultimately that's the optimal wellness that we have always wanted to be a beacon of light towards, to get sick people well without drugs and surgery, to find how to get in and stir the human pot, so to speak, nutritionally, emotionally, physically, so that it elevates them spiritually, and it gives them a confidence and gives them a gusto to go and do what they feel they're being called to do, to hit their purpose marks and to set new goals and to have new heights. And for us, to help you challenge yourself that you can do hard things. Because to the point that, people come in and think that they have to be perfect, and they don't. It's not about being perfect. It's just about one degree of change applied consistently over time. If we can keep just moving the needle a little down the road towards better lifestyle choices, better habits. So many, conversations still for me, even though they're old conversations to me, they're brand new to a person when I'm talking to them about water. I mean, is water really still, a fundamental? Yes, that's why we call it fundamental. But do people neglect how important water is? They go, well, I got all my water in yesterday. Is that enough?
For yesterday.
For yesterday, that's right. And so we've got to make sure that we're tapping into that, because I believe that when the nutrition is balanced, that's the foundation, because we fuel our body. It creates recovery. It creates a healthy elimination. It helps our body to regenerate itself. When by definition, food is supposed to provide life. It's to provide energy, revitalization. And so when people tell me that they get sleepy after a meal, what should our brains do?
Well, that wasn't fuel.
That wasn't fuel. What did I eat that made me sleepy? If by Webster Dictionary, I have that one of those still big, red, heavy, 15-pound dictionary full of words.
And you can find it?
And I can. Believe it or not, I still know how to use that dictionary. But what happens when we're doing 70-80% of the nutrition game well? Where else do we go to hit this optimal wellness?
Well, the next kind of obvious place is the musculoskeletal, right? When you're most of the time when people start eating right, they start thinking about going to work out at the gym, whatever. Mm-hmm. And what does this musculoskeletal side look for? And how is and at Living Well, we have the chiropractic piece that, sometimes that's what the body needs. This body needs interruption. And so when we keep looking at these three sides of this triangle of optimal wellness, when you look musculoskeletal, you can interrupt there. That's why some people just feel better when they go to the gym, right? Now, that doesn't always work. And then people go, well, why not? It will work. It will always work. Movement, we have our sign out front of the office, and Chapa, you know what the sign says
I do.
Today?
Well, I know what it said yesterday. If the dude don't move, the dude don't groove.
Right.
And that has been such a powerful thought over the years, that how important is it that we move well? And how often are we stuck behind a computer? Stuck behind a desk, stuck behind a steering wheel? We are very stagnant as a society, and I think that if the dude don't move physically, then the dude don't groove.
Sometimes we're in a nutrition visit and give somebody like a suggestion on movement or exercises or things they can do, and they're kind of confused, like, this is about nutrition, but how do you get the nutrition into those cells? You got to move. And so I keep this little journal where I make little notes. And last year, about this time, I had a lady who I just showed her some exercises she could do to help with her back, because she has all this pain. We're trying to interrupt the pain with nutrition. And I showed her these few exercises, and 2 days later, I get this sweet email from her saying, I can't believe it. I can do it. My dog's so happy because I'm on the floor playing with him. When the dog's happy, that's when everything goes right.
This is true. I mean, fur babies, for all the fur baby lovers out there. I found that whenever I can't control the stress of life, like because of the externals, I've always kind of resorted to doing a detox, or focusing on some aspect of food. During COVID, with all the restrictions, obviously, I have implemented enough of the nutrition over the years that the next obvious piece for me was, all right, dude, you got to take control of something else. Like, what else can you do to minimize the stress impact of what is coming upon me that is out of my control? Because we oftentimes find ourselves getting distracted from optimal wellness due to external situations that are unseen, like we didn't plan for that, and that are literally forced upon us by other factors that are out of our control completely. So what if we can fight back to that and say, all right, well, then I'm going to start walking. I'm going to start a walking program. What if it is I'm going to start that workout program, or that stretching program, or that breathing program? We can all start somewhere. I had a doctor friend of mine one time fall down a flight of stairs and break his coccyx, his tailbone, the tip of the tailbone. He couldn't stand. He could without pain. He couldn't walk without pain. He couldn't sit without pain. Couldn't lay down without pain. Everything hurt. the only thing that helped from a standpoint of not living in pain was sitting in a yoga swing that he had installed in his house. He actually had several of them, and so he could go to different rooms and have a place to get into where he wouldn't be in pain. But unfortunately, the pain of his body physically, that physical component, was derailing his optimal wellness because all he could think about was pain. And so he slipped off into a depression and frustration and angst and why God me? Did this happen? And a gentleman came across his path. The Lord always sends us a lifeboat, doesn't he?
Always.
Thank God. And this guy happened to be a kung fu master, and the kung fu master taught him the wiggle method. Yes, I know. Sounds great. The wiggle method. Because he was in such pain and dysfunction, the only thing they couldn't really do full out kung fu, but because kung fu is not just a martial art, it's a healing art. And so he was able to teach this fellow how to literally wiggle his tailbone. That's where they started. And they did this through breathing exercises, visualization exercises, and they began to create a redesigning of the physical man through the mental component, the neurological component, the breathing component, which all created a parasympathetic shift out of the sympathetic stress, fight or flight, anxiety, depression, all that pushed to the nth. He was able to begin to pull it back into what we call the rest and digest cycle, the healing and repair cycle. That activation of that physical component started to bring in some relief to his pain, and it changed his life. I mean, and I just think back, wow, like it all started with just learning to wiggle your tailbone. We should all practice that right now. And the interesting thing about it is nobody would even know that you're doing it. You could be in a meeting and you could be doing Kegel exercises. That's a way to create movement at a very subtle level. You can do deep breathing exercises, and there's all kinds, block breathing exercises that would create a shift in how the sympathetic nervous system is swayed back into this parasympathetic, which we have a world that is sympathetically driven, meaning we are in a world where we're constantly being pushed to the brink. We're constantly being stressed out. We're constantly being mentally overloaded. We're constantly being taxed in some capacity, mentally or physically, depending on the job. But it never lets up. And so day in, day out, your body should be able to handle it, except when it can't.
Right.
And so we recognize that we can't necessarily always be 100% perfect in nutrition, but what if don't have to be? We went to a seminar one time where the gentleman was talking about you don't have to be number one in your industry. You can be in the upper echelon, 75% in your industry in 3 different components that set you apart, and now you've got a number one because you've integrated 3 areas. And that's what optimal wellness is for us. We are optimizing your health, your gene code, your nutritional man, your physical man, and ultimately driving us towards a better emotional man. And that could be, we could also say, whoa, man, too, just for those out there that need that. And so we want to make sure that we're taking care of that optimal wellness and seeing the importance that each one of these pieces fit into the grand plan of who we can be. Because when you're in pain, it's hard to focus on who you want to be, or it limits who you can be because of the physicality of the mental pain management day in and day out that people are doing. And a lot of times what begins to happen is they start to pollute their nutrition because they become toxic because of the drugs they take to manage the pain. That completely changes things into the emotional state. Now their brain is beginning to get foggy. Their nervous system isn't firing as crisp and clean, because it's having to navigate around toxins. And we've learned that toxins are anything that your body can't use. So if you're putting in sometimes foods or never foods or medications, and you're overutilizing those medications, you are becoming potentially more toxic than you are becoming healthy. And that will begin to take a toll on us emotionally. And so we want to get people, again, to recognize the piece of the pie of their emotional man. And helping that emotional component start to function, because we are, chemical, that's the nutrition. We are physical, that's the musculoskeletal, and we are definitely emotional. I mean, don't be looking at me funny.
I don't need to look at you funny. I got my own demons.
But that emotional piece. I mean, what are some things that you have done to influence your emotional state?
There's a lot of things that we do, and so one of the things that I do is I have things that I don't compromise on. My healthy habits, my get up in the morning and reading the Bible and or reading. And my daughter and Molly, they gave me this little book that I mentioned a little while ago. That I have a little book that's like got 4 lines where you just put one thing that something about the day. And it's always just, hey, one thing that I enjoyed, one special memory of the day. And it's so awesome now being in that second year of that, because I'm putting this year's memories right next to last year's memories on the same day. And it's just it's a way that I can be reminded that not all things are hard. 80% of the day may be hard, but man, the butterfly in the garden as I took my obligatory walk that day, just melted my heart in that one moment. And
then you sometimes can forget that butterfly moment.
Oh, I would have never remembered that butterfly moment. Never. But it got written in the journal because it was that one thing that day, because it probably was just a generally hard day. We're going to have hard days. And that's why we kind of keep looking at this optimal wellness. Where can we interrupt? Where can we interrupt? And so and I'm in this little project that I started of reading 50 books in a year, which seems like a little crazy, especially when one of the books that I read recently said, hey, maybe you don't need to read 32 books this year. You need to read one book 32 times. And I was like, that's another way to think about it, right? It's just a totally another way to think about what you might do. And so, but all these little books are those nuggets that are helping me to feel more grounded, helping me to really understand who I am. And if you understand who you are and you're comfortable in your own skin, and then people ask you to do things, you know where to set the clear boundaries. You know what to do. So this optimal wellness, but for me, it all started in the nutrition realm. So when we look at optimal wellness in these 3 sides of the triangle, we can look at interrupting any one of those places, because once you interrupt in one place, the rest of the triangle starts
to come together in harmony.
Hey, like a triangle, is there 2 that are the base and one's the top out of the 3?
Yeah, so the base for us is going to be the nutritional component. All life starts and stops at the cellular level. Nutrition drives it. Because the terrible joke that I would say, because people question this sometimes, if I just exercise and never eat, who lives longer?
I think you need the food.
Right.
Yeah, that's what you can't do. You can't avoid it forever.
That's right. So nutrition has to happen, right? All of these have to happen. They all will happen. But I believe that at that rudimentary, fundamental, cellular level, nourishment is critical. It is a key component. And that nourishment gives you the life energy to move and groove. And therefore, you don't have to live by the dude don't move, the dude don't groove mantra. You already are moving and grooving, and so you're accelerating, and you're able to navigate more effectively. Like Jennifer was saying, that then peels into the emotional component where you're like being called up. You're too much is given, much is required. Too much is given, much is asked, the Bible says. And so we get elevated as we continue to grow. A friend of mine yesterday or 2 days ago was asking me, or reminding me that we are a product of the 5 people that we hang out with most, the 5 books that we, or the top 5 books that we read regularly or have read maybe this year, and the 5, maybe podcasts that you're into. We're influenced by what we read, who we hang out with, and what we listen to, and who's influencing you. Are you a blue crab pulling other people down into the pit of misery because misery loves company? Or are you the blossom? Are you the elevator to help people get out of those circumstances, right? And so what kind of climate do you set whenever you walk into the room? Are you the Debbie Downer? Are you the black cloud? Is there always... Are you finding yourself always talking about the negatives of life instead of finding the butterflies, instead of finding the coins? I always find that when patients come in, many times they naturally gravitate and find how God winks at them. Sometimes it's through a butterfly, sometimes so it's through nature, sometimes it's through, for me, I see numbers in random places and or find coins on the ground. And I'm just reminded, in God we trust, and how much I put an emphasis on that spiritual component to navigate, through the day. And I'm always looking for the signs, and so I want to be, influenced by other people to help me continue to grow and never just read 50 books and be done.
Right.
Oh, I read 50 books in 2022. Well, what have you done since then? You know what I mean? And that's a hard kind of bitter pill, because it's just like the water conversation. Well, I drank all my water yesterday. Is that enough for yesterday? So this year for you, Jennifer, like it sounds like the accomplishment of being able to put all those influences in your head inside of a year. Well, I mean, maybe next year God's going to tell you, now of those 50, pick 3, and I want you to read those 50 times this year.
Well, or whatever God asks me to do with that, right? And, right now I'm just pulling out the nuggets out of it. I'm just pulling out the nuggets. There's no way you can absorb that kind of information in such a quick time. I think what's really interesting, I'm reading all these books really fast, but I'm actually, that morning habit that I have where I read the Bible, I'm actually reading the Bible really slow, right? And it's just, that's just where I'm at. This is how I'm growing this year. So if everybody takes a component and takes a hold of that one piece that they feel like they can take a hold of, or heck, if you can't take a hold of it, go hang on to somebody else's shirt tail for a little while and let them help you.
That's
right.
That's the influence conversation.
That's what you have to do, and that's where a lot of people start, right? And you look at that, the food component and then the nutrition component, and yeah, it's impossible. You were going to go back down that road of it's impossible to eat perfect 100% of the time. It's so funny. Sometimes it's like, well, that's when, I'm just not going to take my supplements because
it's not perfect.
I'm not doing perfect.
Right.
I'm not taking good care. No. Like that is another way
All
you
the
can
more
interrupt,
reason
right?
Yeah.
And you guys, you living well clinicians, you take way too many supplements. Okay, like, but can
what
you
are you
take
willing
one?
to do?
Can you take 2? Can you take 3? What can you take? How much are you willing to interrupt? And each time you interrupt, God, like you said, too much is given, much is required. God levels you up a little bit more and a little bit more and a little bit more. And he asks a little bit more of you. And they talk about, like with the books, that most people never read another book after they graduate from high school. That's the majority of people. And you think, wow, like that's for
impressive.
me. For me, I'm like,
really.
it's like, but you think about it, and it's like for me,
But
it's
it
like
should not be impressive. It should be scary.
It's impressive. I mean, not like in a good way. I'm just saying, like, wow. I mean, that's impressive.
Yeah. Well, I was just listening. There was a stat that came across that like 1 in 4 millennial age kids past 25, they suffer with depression, anxiety, and it's a lot of times because they don't know who they want to be when they grow up. They're literally drowning in the sea of information. So many different things, so many options. They don't know which path to take, and they can't find one that they're passionate about, or they haven't been taught how to take care of themselves, so they are just getting blasted with all kinds of I gotta do's, and all of that stuff adds up, and they're struggling to navigate their path. And for us, I really believe, I mean, because I've seen this in my clinic, and my clinic teaches me a lot of this triangle, and how optimal wellness begins to look. I had a case of a patient come in that was suicidal. And she was really struggling, and the only thing we could do, I mean, she was on like 9 or 10 different psychological drugs, and the only thing that I could get her to do was take a shake, take one supplement, and eat intermittent fasting level keto. I mean, that was it. So we did the butter coffee business in the morning. We got her drinking her water, her one shake at lunch, or mid-afternoon because she didn't eat till noon, and with the keto with the intermittent fasting keto coffee, and then the adrenal supplement, and slowly but surely, like you were saying, that nutritional component began to shift something, and that led to another piece that she was willing to do. And before I knew it, I had her on a fair nutritional intervention program. She still wasn't eating great. She was still doing just the intermittent fasting and the shake kind of stuff, and maybe a meal or two from time to time. But then she got involved in goat yoga, like where the little goats walk on your back. And I was like,
we've done it in studio. It's pretty fun.
I wish I was invited.
I could probably arrange that on a Tuesday if you want.
Yeah, that'd be cool.
Hey, that's a good idea for an event at our event center.
Yeah, that'd be awesome. And then you've got the next thing I noticed, what she told me, is she began to do roller derby and started becoming active, that physical component. All right. So, it wasn't as that we came in the emotional door and said, hey, you need to get off all these medications, or, hey, you just need to think different or think better, or you can't think like that. We didn't have those conversations. We started with what she was willing to do in the nutrition realm, and we pulled out. That's why we say a lot of times that what you eat's important, but what you
don't eat
is more important. And so by taking out all those inflammatory agents and those inflammatory foods, it began to change the life. And then the life began to evolve, and they began to become more active and moving. And then the next conversation I had was tears, the recognition that for the last 30 days, for the first time in 10, 12 years, there was no suicidal thought. And then the job promotion came. And then the boyfriend came. And the continuation and the evolution of the life began to evolve into this optimal wellness path. And all aspects came together slowly but surely. And we were able to start weaning them off the medication to the point where instead of it being 8 meds or 10, I can't remember now, but it got down to one less. And it wasn't like we were taking her off the medication. That's not my scope of practice, is that the patient began to feel good enough to make one more degree of change. And then we talked with their psychological doc that gave her the meds, and they were willing to take her off, 1 or 2 or a half a tablet of this, and begin to change the game. And before we knew it, the life had changed. And it doesn't matter which point of entry we come in, it's all about creating harmony between all aspects of the structural, the chemical, and the emotional. That begins to influence who we are at our core level, our spiritual level. And there's an elevation. And then that person maybe begins to read books or listen to better CDs or associate with different people. Maybe they got to go through that challenge of pruning some of the bad fruit off of their social circle tree. And they have to change the circle of trust, and because they don't want to be influenced with the things that were poisoning their body. So they're more confident to take a step back. What you were talking about earlier, setting boundaries, and big things begin to change. And so optimal wellness for us isn't just food. It's taking ownership of the biochemical piece that we can control. Look, I know we can't all eat organic. I get it that we can't all stop the sugar. I get it that we can't avoid poison each and every day at every juncture of time. I mean, there are some environmental uncontrollable factors, but you can do enough things well in the nutrition realm that will influence how you perform physically. And then the more active you become, you don't have to be competing at the X Games or the CrossFit National or the bodybuilding or the martial art black belt association thing. You get to.
That's right. You get to.
And
you have an opportunity. You open the doors. You open those doors for whatever God's calling you to do. And if you're not opening those doors, if those doors seem closed, it's not because God's not there with opportunity for you. It's that you're not able to take initiative
to get
into that space. And if we just find one place to interrupt, just one place, and so we just, as we look at that building and we look at the things we're going to be able to do there, we're like, where's your one place you're willing to interrupt? What can you do? What can you do? And with the nutrition piece, it's what can you do? But you listen to that story that's really super inspiring of somebody coming from suicidal to living a more abundant life, right? And you look at that piece, and do you think she never is going to have trials and tribulations ever again?
They'll come.
They're going to come, right? Mm-hmm. They're going to keep coming no matter what. But the question is are those winds and waves going to toss us to and fro? And so we want to get in that space where we recognize, hey, there's still going to be these challenges that we face, whether they be physical challenges, whether they be, we talk about, well, you can control your food. Well, maybe, but we could also control our, we can control, can we control our environment? Can we control the fact that we live in an area where there's cars running all the time, and we're subject to car exhaust all day long.
Refineries and those kind of things, yeah.
And how far away do you have to get before it doesn't affect you? It's okay. Again, another impossibility. What about the natural, the mold, the fungus, the bacteria, the viruses? We can't avoid them all, and that's not what we're about. We're not about avoiding the bad. It's if we're in an optimal wellness state, it's about being able to live with it and letting God do what he does. It's so funny when you think about the physiological aspects of wellness. God kind of has like the plan A, the plan B, the plan C. And so I have to do this just for the fun of it. But, the bowels are your primary exit channel for the toxicity. But when it's not working well, God has plan B. He can use the lungs, the skin, plan C, the kidneys. So he uses all of these components. He's got all this backdrop for us. And so it's like, if we just do a little bit, our next part, we'll get to that optimal wellness. And it doesn't mean never getting sick. That's the whole thing. It's what do I do when I get sick?
And how does my body respond this time when I get sick compared to the last time? And, I think I was just, listening to that idea of one thing, and I just happened to start, reading a book just recently called The One Thing.
Of course.
And so it's
that's how our world goes, Guardian.
Yeah, it's just back and forth. And it's just amazing because what is the one thing? We remember the Billy Crystal, gosh, I just drew a blank on the name of the movie, but I remember he was in it, and he had the old guy, and he would always tell Billy, because he was out there trying to find himself out in the wilderness. City Slickers, that was what it was. And he couldn't figure out, his purpose. He was having marital problems. He was in financial crisis. He was stressed to the gill. He was, probably, they didn't talk about it, but he was probably constipated, and so he was probably
having. That's a guarantee.
That's right. He was definitely having some trouble there. And so, and the old man was told him, you just got to find the one thing. Well, he goes, well, what's the one thing? What's the one thing? He goes, that's what you got to figure out. The one thing. And that one thing really is what is your next one thing that you're willing to change, even if you don't know your one thing? Can you still change one thing?
Absolutely.
And it could be one thought. It could be one meal. It could be one lifestyle choice, whether it's, better sleep, whether it's better water intake. And the more you can apply that continual practice day in and day out, now it's harmony. And optimal wellness begins to rise up and bubble up, and people start to see it. And it's what I've been told, that people will come miles and miles to watch you burn. When you're on fire, when you're lit up, when you're excited, when you're, doing what you're called to do because you were willing to do those one thing, change moments in the seasons that they came to you and knocked on your door and you said, come on in, I need the change today. I need that one new thing. And you start to apply that even if you don't understand all of it. It's okay if you don't understand the biochemistry like we do. It's okay if you don't understand the nervous system like we do. It's okay if you don't know how you're going to get off of 8 medications today. Because we don't need you to understand the big picture. We just need you to understand if you can change one thing, the big picture will begin to reveal itself. And then that gives you that, again, confidence to like, oh, this isn't as hard as I thought it was. I remember the dude in the overalls comes in. He was what I like to say, so forgive me if it's offensive, the country bumpkin. And he was smelly. He was, he was big old dude, and he had like a dip can emblem in his pants pocket in the back. He didn't have a dip can in there, but he obviously dipped because you could see
there
it.
Was history.
There was history.
It was in there for years.
And yeah, for sure. And I remember taking his boot off, and I about passed out, and I was just like, God, this dude is just so unhealthy, And we went in the structural door. He did not come in there for nutrition. He came in because his foot hurt. Well, thankfully for him, I was okay.
It was hurting you too.
Yeah,
right?
I was okay
hurt more?
with feet, and I was tolerant of the smell of these feet. And I remember working on this guy because we don't just address your symptom, we address the whole biochemistry, or in this case, neurology. We address the entire spine. We looked at the top down, the north-south, the soul, back up to the head. And we started working on this guy, and inside of 6 months, he began to have implement changes that we had started with, that structural invitation to come into that door. We changed some biochemical choices, drinking more water, focusing on breakfast, making sure the breakfast is protein and not sugar, making sure that he's not getting into the artificial sugars or the deadly 4 food additives like high fructose corn syrup and partially hydrogenated oils and all these poisons that begin to pollute the body. We took those things out, and then that began to change his attitude on things more. He was willing to change not just one thing, but 2 things and 3 things, and his confidence began to rise, and people started commenting, hey, bud, you look like you're losing weight. Hey, bud, you look like you're feeling great. You should come do this. He got invited to do more movement stuff. He got involved in yoga. Country bumpkin, big old dude doing yoga. I was like, wow. And then and he came, I remember, I'll never forget, he came in and at the 8 or 9 month mark, and he goes, I haven't dipped in 3 months. And I go, oh, well, when were you going to tell me that you were going to stop dipping? He goes, it just kind of happened. I didn't mean for it to happen. It just kind of happened. And I said, well, what have you noticed? He goes, I can think clearer. Like my brain has been feeling so good that I just felt like I could get off of it, and I did, and now my brain's even better. I said, did you have withdrawals? He goes, well, maybe, but I don't. They didn't stop me. Like, they weren't like, I was so excited about all the other things going on, and he. It went from a guy that really didn't talk much because he was internalizing or he was dealing with or frustrated with, to a guy that was bubbly and just overjoyed with his life. And we just started with foot pain. You know what I mean? And so wherever you're at today, we want to encourage you. You could be the emotional component patient that needs support in that area. We'll be there for you. You could be the structural glitched patient that we'll step in the gap for. You could be the biochemical person that absolutely has to make some lifestyle diet choices. Ultimately, we want you to buy into the idea that there is a better way of living out the days on this earth. You don't have to suffer with diseases and symptoms at the level that maybe you're being told, oh, sorry, you're getting older.
Yeah,
oh,
that's normal.
That's
normal.
normal. Oh, you're 55 and you're only taking 3 medications? Well, the average is taking 5, so you're doing better than the average. You see what I'm saying? Like, no, guys, we have to have a different outlook of what do you want when you've finished living? Do you want to be fully functional in spirit, mind, and body, or do you want to be decrepit and in that slow goodbye stage where you're just declining and you're, I don't want to say a burden to those around you, but maybe a burden to those around you,
or unable to do the things that you want to do, even if it's just to be able to read those books. I mean, I thought about that. Reading them now before my 50th birthday, I'm thinking, well, what if I could read 100 before I turn 100 before my 100th birthday in that year? And you think about it, and it's like, well, in order to be able to read 100 books, my eyes still have to be functioning, my brain still has to be functioning, and so giving myself the opportunity to get as far as God allows. Like, He knows the day and hour that we have and how many days and hours. He's got that all worked out. But are we using it to glorify Him? And each day as we reach out for this optimal wellness, as opposed to just this idea of, although there's so many things that we can do to turn around disease with nutrition, so many things. We see miracles so often that they don't even look like miracles to us anymore. They're like, oh, that's...
They're expectations. We expect miracles.
People say things, and I had a lady. She didn't even tell me about something she was dealing with. She was dealing with vaginal yeast thing. Didn't even tell me, and she's like, it kind of went away. Well, oh. Of course it did, because that's what nutrition does. Of course it did. And so we expect it to go away.
It's what the body's supposed to do when it's fed right? The body's been designed to heal. And so when we have these crazy symptoms and we've tried antibiotics and we've tried steroids and we've tried the antibiotics again and the steroids again, we've got to recognize that something else is driving the infection.
But a lot of times those symptoms start so small that that must be normal. Must be normal. It's not making it hard for me to, I have a little back pain, but it's not making it hard for me to get around. So it's gonna be fine. And so we keep kind of ignoring it, whereas we can put the nutrition in, we can interrupt, and we can get into that optimal wellness so that, and that's the challenge, right? We don't really know. Did I make it 80% better or 60% better or 40% better? We don't know. We can't know for sure. But I know this, if I'm going to give it my all, I have to give myself the tools for optimal wellness. I have to be looking at those 3 sides of that triangle, and I have to be going, where can I interrupt? What can I do? And we want to be that with you. We want to get in the boat with you and help you find that first place to interrupt. I'm going to help you find your one thing. And it's going to be something different for everybody. That's why we don't have, this nutrition program that you can just go buy on the internet from us, because it's an individual thing. You've been through a lot of different things that I haven't been through. And as we go through those things and we work through them, we can find those places to interrupt. And it makes it so that you can reach that optimal wellness, even though there will be challenges,
And so as we wrap up today, living well is just, we have this underlying driving desire to bring a message of hope, healing, wellness, opportunity that is sitting before you. You We just got to help you see it. We've got to help you recognize, what steps to take in the direction that you can make. One of my prayers for you guys and for, my family that I pray often is that the Lord would make the crooked path straight and the rough path smooth. And I believe that on our quest towards optimization of the wellness picture, to become the best version of ourselves so that we can blow the capacity off our own mental limitations, we come in the door of nutrition. We come in the door of the structural body, the neurological body, and we come in the door of these emotional components, and we make sure that you don't have a crack in your foundation. So when you visualize this thing as a triangle, lay the triangle down flat. And don't look at it like you asked a good question earlier, is there a base? Yes, we do see it as nutrition as the fundamental backbone, but if you lay that triangle down, it itself becomes the human foundation for which you build a strong, deep spiritual life on. It's what you build a strong, deep marital life on. It's what you build a strong, deep, financial picture on, a business picture on, a goal setting. You can start kind of plug and play the other pieces of what you hope to accomplish in life into that realm of the pyramid now, and we put spirit at the very top because ultimately for us, the spiritual lifting of our eyes to the heavens and glorifying God is what we're here to do, to say and proclaim the name of Jesus Christ to all that we come into contact with, to be that light is ultimately what we want people to see before they ever see us. But we recognize that you might be dealing with something in your thinking pattern that is very scary. Maybe you've been through a lot of turmoil and challenge, and there's legitimate reason for it to be there. Mm-hmm. But what can we do? What is that one thing that we can do so that we don't let you or that person sit in misery? Because there always is one thing we can do, or we come in and we work on your foot, like we talked about earlier. Like, what is that space? And we want to put, that foundation in place, recognizing that people have issues in different capacities in and throughout their bodies, structurally, chemically, and emotionally, that create a shift and a change on who they will be. And we want to help shape you into the man or woman of God that God has called you to be, and help you blow the capacity off. And Living Well wants to be your health and wellness resource coach. We want to be there whenever you get the diagnosis, and we want to be there and help serve you to the point that you maybe didn't realize was possible. And we want to start giving you options and tools and resources to elevate up. So as we expand our thinking and we move into this new building, as we at Living Well continue to bring a message, we invite you to come with us. We invite you to choose one good, healthy habit today. And we're excited that you guys are tuned in. We're excited that you guys are subscribed. We're excited that y'all are willing to share the message, because people need this in their lives. They really, really do. And so we are changing sort of the platform of our shows, and wanting to just continue to educate about health, right? But we also want to, potentially bring in some of these, what can we do to sharpen our mental axe? Right? The 50 books concept. I'm sure these nuggets that Jennifer has gleaned from the books that she's been reading is probably going to be reused in some capacity in her patient's life, in her family's life, in her relationships' lives. And it's not going to just be that's just something I just checked off the old list. Because when you're allowing influence to come in a positive way through books, through CDs, and through interactions with other people and application, the change is coming. The change is going to be a blossom. And so we pray that you continue to thrive each and every day, and we're excited about where we're going, and we're looking really forward to bringing you along with us. Jennifer, do you have anything else to say?
No, I'm just excited to bring everybody along with us. This healthcare journey is something that you need people to do with, and so we're reaching out to you. The only other thing is, We'd love for you to come see us at 815 East Main Street this week. But
this week.
Next week, you're going to come to 322 East Main Street to see us at Living Well Clinical Nutrition Center. So
same road.
Join us either place.
It's exciting.
Yeah,
it's very exciting.
It's pretty cool. So y'all have a great and wonderful day. God bless you all, and we'll see you next week.
This is KHEA Radio, 99.5 FM.